Hi, this is Jill with Trevor and Jill Talk. I am with my partner Trevor Bellenew. We're having a fascinating discussion today with Dr. Snowball, her daughter Emma Robinson, and it's at their practice in Stamford, Connecticut, where they practice integrative medicine that really helps you look good and feel good. We are learning so many things about so many ways to help decrease pain, look better, feel better, and we're going to concentrate this discussion on one area which is pretty fascinating, which is platelet-rich plasma, or better for me to say PRP.
PRP.
And there's so many applications, things that you use this for. Would you like to start out by just telling us
What is it?
What is it? You're always hearing PRP. How does it figure into your
Sure. Platelet-rich plasma, or PRP, is a concentration of platelets. Platelets contain growth factors. Platelets contain cell signaling factors that have been shown to play a significant role in the biology of cell healing. The process is a blood draw. Then the blood that's collected,
like a normal, take a few tubes, or
Yeah,
Right.
it's actually
Your own blood.
Yeah,
Your
your
blood,
blood.
yeah.
And you require much less. Originally, you used to have to take a lot more. Now it's a very small amount.
we centrifuge it, Emma centrifuges it, and the blood layers out into components, and we collect the platelet-rich plasma component and then deliver it into, in my world, a painful joint. It could be an elbow, it could be a knee, it could be a hip. And
Or all
in Emma's
together.
world,
Yeah.
did you want to explain
Yeah,
that
and then
application?
again, it's nice because it's a crossover with aesthetics and pain. With the regenerative therapies, you have the PRP that works great for hair loss, improved skin. I don't know if you've heard about the vampire facelift.
Oh, yeah, of
That's sort of the
I never really understood what that was.
Well, originally when PRP was first being used, the centrifuges, there was more of the red blood cells were left in it, so when you would have it applied to your face, it looked like you had blood on your face. But at this point, the centrifuges are really effective. You're using a small amount, and it's just the plasma that is really all you see, so it's almost like a golden color. So it's not as dramatic as it used to be, but it works beautifully for sort of regenerating the skin, just making it look healthier. Hair loss is great. You do have to be somebody you have to have some hair in the area. You can't be completely bald, essentially, because once the follicles are dead, you can't revive them. You're essentially reactivating follicles that are still, able to function.
This is something that a lot of women use too, right? Especially
Yes,
after menopause.
Absolutely. And
With
women
hair.
respond really well to it. Men and women, I mean both. But women in particular, they found in studies, respond very quickly to it. So,
So an alopecia patient, for example, hair loss on eyebrows, head.
yeah, more the head, I would say, and it's usually where areas are thinning, like typically here, a lot of women, sometimes it's just right on the top. The thing about the treatment is that usually the studies show it requires up to 6 treatments, once a month for 6 months. But, people, we're not all black and white. It's, there's that gray area. So some people respond after 1, some people after 3, some people need more. Again, it's one of those things that's slow. It's not a quick fix, but it's a really high quality, great results. You're not putting a Band-Aid on something, which is
And
what
you
I
can
like.
really see the result. That's kind of cool to see
Absolutely.
new hair growth.
Yeah.
That makes somebody feel really good.
100%.
Right? Talk
yeah.
about alleviating pain. in different ways.
With alleviating pain,
That's huge,
the
it is.
PRP can, we can get significant gains with one treatment in a painful joint, but depending on the chronicity and the complexity of the injury in the joint, sometimes a second and a third treatment is needed, and we try to do those within about a 3-month period.
And how long does that last for, typically?
It can last, it depends on the severity of the injury. I had one golfer explain it to me this way. I thought he did this very well. He said he'd given up golfing, he'd given up boating because of his knee pain. He went through the treatments with us. He said, I'm still not able to successfully play golf. He actually went to have surgery, arthroscopic surgery, came back, still didn't get his outcome. And I suggested PRP to him for his knee pain. I said, follow up with PRP, it'll help also with the post-op healing. He did that. He got about 60% relief of his knee pain, enough to go back to golf.
Wow.
And he
That's
then
wonderful.
went back to the surgeon for a follow-up, and the surgeon said, oh, go have another PRP, since you're 60% improved. Came back for another, and he had resolution of his knee pain. and is back playing golf the way he likes to do, probably mostly
You are
daily.
his heroine.
Yeah, exactly.
Wow.
But
Yeah.
I've had joint pain, and I know the doctors have given me two options: cortisone shots or an invasive surgery. So it's wonderful to hear there's an alternative that is not invasive that actually is proving now,
Right.
research-wise,
Yes,
to be really effective.
yes.
So that makes me feel good. I'm going to come back here myself.
Now, there are some people, as we were discussing, this isn't going to be appropriate for.
Right.
So that's
Correct.
important to say
Right.
before we,
Right.
so that would be in any of these applications, correct?
Absolutely, yeah.
Yeah.
If you've ever had a history of cancer, unfortunately, you're not a candidate for it. And then autoimmune would also
Disorders,
be,
yeah. We don't use it for. And then
However,
yeah, we offer another alternative, which is the world of biologics. And the chemicals are actually obtained from donated placentas from C-sections. And the FDA has regulations that the blood bank follows in order to extract the chemicals that are contained in the stem cells. And we were speaking earlier about a placenta growing a human being, so it's going to be loaded with stem cells. So what we're buying from the blood bank is acellular. It has no cells in it at all, but rather the chemicals that are contained in the stem cells. And at the end of the day, even when we do regenerative therapy or stem cell therapy, we're after the chemicals that are contained in the cell anyway. And then we inject those in lieu of that person's own cells.
Are you seeing a difference between PRP and the placenta cells, or
The placental matrix, I think they just have, each have a role
okay?
to play. I think PRP and placental matrix are effective. Sometimes I'll use placental matrix in a small joint because there's up to 7 cc's of volume from PRP, and there's no way one small joint in a hand or a foot is going to accommodate that volume. So the placental matrix is a third of that volume. So
So you don't like a trigger finger kind of a thing?
Yeah.
trigger finger, or Emma has her
I know.
own example of her
yeah,
foot.
yeah. I was gonna say, because I can speak from experience. So I
Because
do.
we heard your Iron Man or Iron Woman.
Yes, Iron Woman.
For the
Really
Thank
impressive.
you. But I obviously do a lot of running, much to her chagrin. And I end up with foot issues. And one of the issues I've had this past year was tarsal tunnel and some pain that goes around my ankle. So in October, we did a series, we did placental matrix, and it's now, we're going on several months, but I'd say about probably 4 months ago, it completely resolved. Every time I ran before, I would have that achy pain, and now I run, there is zero pain. It's amazing. Again, it's slow, that you just have to have patience. It's these, we're trying to avoid medications. Those are the quick
I was
fixes.
about to say,
Yeah.
and that's one thing Jill and I talk about quite a bit, right? So relevant today with the opioid addiction crisis, which is managing pain in different ways.
Right, it is.
And then you
That's
get
why
on
we
so
need to do
many of these different medications also that you don't know what the
And there's side
interactions
effects.
with all the other things that you're doing.
Right, or the long-term impact.
Mhm.
Yeah,
Which we've been reading about recently, that's something we were
Right.
talking about, that they may impact dementia,
Uh-huh.
et cetera, so.
Right.
less-
And then, speaking to the point of the time that we need to allow for healing, whenever our body heals itself or is supported in healing itself, it's always slower, but it's always better.
Mhm.
You think about, she always says, think about a scab. When you used to skin your knee as a kid, how long it takes to become skin again. It's slow, but then
Days.
it's gone,
7
unless
days,
you have a scar. It's a bad bite.
If you
Yeah.
did this while you were in school.
I know, just a little bit.
But it is really important, and again, having these options and non-invasive, well, a little bit, I mean, they're shots, right?
Right,
It's not
It's
the
a
EPAT.
shot, but it's not really invasive.
Is
It's an
there
EM, yeah.
downtime in any of this?
There isn't. There's
Interesting.
no downtime. For the joint treatments, it takes about 20 minutes, 30 minutes. And then the person can go right to work, resume activities of daily living. We do suggest that the elective activities be restricted for about a week, because we want the cells that we've planted in a particular area of the body or the joint to anchor and stay put. So that's why we restrict the elective activities, like going to the gym, or you can do upper body if we're injected in the knee, but not lower body exercising.
That makes sense.
Yeah.
And is any of this covered by insurance?
Good questions, yeah, and only in very extenuating circumstances, but not usually in the context that we're discussing it. So not for osteoarthritis of a joint.
That's great.
I
It
That's
is
know.
crazy,
Really.
yeah.
Maybe they'll get there.
I think
as
they'll get there.
Like a lot of things, as they
Yeah.
realize maybe they'll save.
They
costs
see
if
results.
If it's
Right.
right.
And it's
Right.
going to be
Becomes
less
a-
expensive than an invasive surgery, right?
Absolutely,
So,
yeah.
and
Preventing a
it's
joint
cost
replacement,
effective.
holding off from getting one.
Right.
Yeah.
So many of my friends have had knee replacements and hip replacements.
Yeah.
Would this put this off maybe?
Right.
Right.
Well,
Yeah.
it's a good question. I actually have this conversation with my patients, is
Huh.
to think about a painful joint as the equivalent of having a small cavity in your tooth. You want to be proactive and you want to save the tooth rather than let that, we don't say to ourselves, well, let that cavity go along until I have to have the tooth extracted.
Or a root
Right,
canal.
right.
Yeah. Something horrible.
So, yeah, just kind of jump on it early and deal with it early. A lot of the treatments, especially in the knees, are natural and can be very helpful in saving our joints.
That's
The
really
dream
good advice.
MRI
Yeah.
is if someone's had knee pain and we've gone through a knee treatment of hyaluronic acid or gel shots and then the PRP, and an issue has cropped up some years down the road, they've been pain-free, but an issue came, new injury, it suddenly popped up again, and we repeat the MRI to see what's changed, and the reading from the MRI is no interval change.
Mhm.
So that's what we're after. You know, we can't change a joint, but we can keep it from hurting, and we can try to keep it from progressing or slow up the progression.
That's important.
Yeah.
I think everybody just wants to extend their time.
Right.
We want to be more
as long
active.
as possible
Yeah.
that way
Yeah.
until they have to go to something major.
And I think it's
That's
different than our
very welcome.
grandparents. The other generations, I feel like you think back to your grandparents being so elderly at a young age. Now we're active
Living
right through. Yeah.
Much longer.
We don't want to stop.
Literally, a friend of mine just said he had his knees replaced, and he's a big runner, and the doctor said, this is going to last for a certain amount of time, and if you continue to run, they won't last as long.
Yeah.
So there's so many good reasons to sort of save your joints, take good care of them, use alternative therapies as long as possible.
Right. There's nothing better than your own
Yeah.
joint at the end
Yes,
of the day.
your own
right?
joint,
Yeah.
of course.
Yeah. So we want to save them as much as we can. Yeah. Another element to saving joints too is strengthening muscles.
Yes.
And we all go to refer patients to physical therapy, and the patients go, "Oh no," and there are so many studies to show how effective it is. Mayo Clinic did a study and showed that strong thighs, the equivalent of a strong core, will slow up. They use the word thwart, arthritic progression of the knee.
That's huge.
Yeah.
There you go, bar class.
Yeah.
But I also think it
Worse
works
than torture, maybe.
part of this that isn't appreciated so much, and I love to do it. I'm really into flexibility.
Right.
I was a competitive figure skater when I was younger. I had to be very flexible to do some of this stuff. So maintaining that as you get older, it's hard, right? Because it
Right.
hurts.
Yeah.
Right.
But it's
Yeah.
important.
It's important, right?
Yeah.
So between the strength and flexibility, saving
Right.
your joints, and hopefully
Right.
living
Yeah.
longer. And
Yeah, hopefully the
Moving.
exercises
Moving.
don't hurt when you get to a certain point, because we address the no pain, no gain is actually a myth. We ought not to be sore, and then maybe change up or modify the exercise. There's so many exercises that we all know that we can do, and we can't do them all. We don't want to do 2 hours of exercising, so we're customizing options that progress us without pain.
that's
Yeah.
wonderful. Wonderful. Anything else, Jill?
This is all really good.
We learned a lot
I really
today, and
appreciate
I'm
it.
personally coming back.
Anytime.
Yeah.